When to start thinking about IVF? 1 in 6 Australian couples need help to conceive. Many ultimately require IVF. Success rates in IVF are at their best when performed with holistic care in the best hands. IVF success rates are affected by your age, and unfortunately, some people present for help too late, at a stage where IVF with a person's own eggs can no longer help. Age-related egg quality decline is our biggest challenge as IVF clinicians. What if you've been trying for 6 months and are over 35? If you're over 35 and haven't been able to conceive after 6 months of trying, you owe it to yourself to be fully investigated as a couple. At least 50% of infertility is either partly or solely due to a male factor. What about unexplained infertility? Unexplained infertility is a label given to couples when basic tests have not identified the cause for their very real struggles to conceive. Being diagnosed with unexplained infertility does not mean everything is okay. There is ultimately always a reason. In a large proportion of patients, silent endometriosis not evident on pelvic ultrasound is to blame. A significant number of women with endometriosis affecting fertility do not report severe pelvic pain. A laparoscopic surgical assessment is needed to confirm a diagnosis of endometriosis. Most couples with normal fertility conceive relatively quickly. Over 80% will be pregnant after 6 months of trying, and 90% after 12 months of trying. We think the vast majority of true unexplained infertility is due to rare problems occurring in the hundreds of protein interactions that must occur between sperm and eggs in the body. IVF and ICSI is able to get around these problems for more than 80% of couples with no clear medical label for their real fertility problems. IVF can be used to treat a genetic condition. If you or your partner have a genetic condition that you don't want to pass on to your baby, you can choose IVF to help you get pregnant. Couples with normal fertility may choose IVF for a genetic reason. Genetic testing of embryos in IVF can help couples at risk of genetic diseases. By creating embryos in the IVF lab and testing them, we can ensure only healthy embryos are implanted to make babies. Many serious conditions can be avoided in this way. Examples include cystic fibrosis, muscular dystrophy, Tay-Sachs disease, achondroplasia, and genetic conditions passing on a high lifetime cancer risk. As long as we know the DNA details of the genetic problem affecting your family, we can develop a test for it. What if a woman has severe endometriosis? Those with severe endometriosis often need subspecialist IVF care to conceive, even after expert excision surgery. Seeking help at an earlier age will improve your prognosis for ultimate success. Endometriosis is a progressive condition with a high recurrence rate. Young women with endometriosis should give serious consideration to freezing their eggs. What if my partner has had a vasectomy? Surgical vasectomy reversal is sometimes possible, but IVF often has better success rates. This is especially true if the vasectomy was performed a long time ago, as men are more likely to have a failed reversal attempt or to have formed autoimmune antibodies against their sperm. What about family planning longer term? You're over 35, pregnancy isn't happening naturally, and you want to have more than one baby. If you're starting your family later in life, consider embryo freezing as a long-term family planning strategy. You may otherwise not be able to have the number of babies you want without help. IVF offers the unique opportunity to bank frozen embryos by proactively freezing while you can still make embryos. You may greatly enhance your chance of having the number of children you ideally want over the next few years. Pre-implantation genetic testing of embryos for aneuploidy, PGTA, is an option that can reduce your chance of miscarriage or having a baby with a serious chromosomal condition like Down syndrome.